Hi. So it's been a long while since I've made a non-educational video. In this video, I wanted to discuss the scope of pathology in the context of AI. So the question here is pathology, MD pathology, worth doing in India, especially in the 2025 year? With artificial intelligence evolving more day by day, are pathologists going to become obsolete? Or there's a possibility that there could be a revolution in diagnostics. Pathologists will become more central to the role of critical care because personalized medicine is where we're headed. I want to say this, I don't have exact answers because we are not in the future yet. We can see the implications of the future. We can detect the stench of the future, right? We are not there yet completely. So I don't have exact answers, but I just wanted to discuss this point honestly and critically. So traditionally, pathologists have been in the non-clinical spectrum of things. We do interact with patients, but we are not, dealing with every day and night. We don't have emergency shifts. We don't have night shifts. Choose pathology if you if you didn't wanted a very high patient volume branch, and you wanted some work-life balance as well, which is unheard of in the clinical branches. So in future, when it comes to AI, in future we might have algorithms which could give you Gleason scoring in seconds and much more accurately than those of the pathologists. Could in fact find tubercular bacilli in seconds when in fact it takes us a few minutes. Whole slide imaging and combine that with machine learning, the result will be faster, more accurate, and help in the prognosis of the patient. Every branch is saturated. Now, the Indian reality, right, when it comes to the job and the career, you don't want me to go on and on about AI, you want me to tell you, do we have options? So every branch is saturated. Don't let anybody fool you, or don't let anybody make you feel guilty for choosing pathology or any other branch for that matter. Every branch is saturated. We are an overpopulated country. I mean, what do you expect, right? So teaching jobs are saturated in medical colleges. Teaching jobs are fairly saturated. You can work in a diagnostic lab, or you can open up your own lab, but that does require a certain level of investment. But if you're working for another lab, you might not be paid that heftily in the beginning, just after MD. In the private sector, you need a few things, like you need upskilling, you need some networking skills for you to survive in that culture. So the truth of the matter is this, the crux of that matter is this, that the AI may replace your routine microscopy in 10 years. So in the last video, I had talked about autohemoanalyzers and how they have not completely replaced us. We need them, but they have helped us because we don't have to look through all the slides, right? But every time we see some gadbadation, we know that it is the pathologist who has to sign the actual report of the patient. So in that case, you see that the doctors, the pathologists have worked in tandem with the automated hemolyzers instead of being completely replaced by them. So that is what I am looking at. I think we will be going towards high-end molecular techniques, and for that you will need the pathologist's knowledge. Now the option is with you. It is your call whether you're going to upskill or you're going to be obsolete. AI will not eliminate pathologists, but it will. I read somewhere that AI will not eliminate doctors, but it will eliminate the ones who are not using AI, who are not evolving with AI. We know the future. We know it is here. It is best to become accustomed. I mean, there's some people who are choosing to go abroad. I mean, the pay is better. They do have more demand of pathologists, and pathologists in West in fact lead tumor boards, which will be unheard of in this country. And everybody kind of knows the reputation pathologists carry. Part of it is the commission that clinicians get when they sponsor some other lab and not the hospitals that they're working in, because everybody knows that people are doing private practice along with the government jobs. There's a lot of greed that is at play here. Pathologists have contributed to their own suffering as well, because what we have done is give our names to any lab, and they have used our names. A lot of fraud cases have been coming up, right? So I have also received calls where people asked my registration number and I have not given it to any one of them. So it is incumbent upon you as a pathologist to have some assertiveness and to have some dignity for your own branch. Because if you're going to give your registration number to any random lab in a small village, this is you are only decreasing the respect for your own lab. The answer to your question, is it worth it? It is yes. Pathology is worth it. Pathology is worth it if you're intellectually curious about the subject. You need to combine your textbook knowledge and not your chat GPT knowledge. The knowledge that you acquired from textbooks, which is research based, right? You at the end of every chapter in any book in the medical world, you see a lot of resource, see a lot of references. That is research, right? So every data, every single line in your books is made from that research. It is not hawa mein that this age may this cancer, or this age this gender may whatever entity is more prominent. That has been done by research. So you have to take your textbook knowledge and the current knowledge of the practice that you're having in your pathology field, and you have to combine it with technology as the technology is booming and coming into picture. This will happen. This is inevitable. You can either be a part of it or you can be against it. If you plan to specialize, I think AI will be much more in line, in cahoots. I think AI will be much more in cahoots with the branches, and I'm not using the word cahoots in a bad way, in the branches where there is a scope of super specialty. So if you want to do oncopathology or hematopathology or all of those fellowships or DM in pathology, there is scope for you to understand AI way better than the ones who have not done that. And of course it is not for you if you don't want to create your own niche. You are not open to the technical aspects of the lab medicine, so that means that you will not be fitting well with the future of pathology as a career options. One last line I wanted to add, which I forgot, was that in the future, medical world in general, not just pathology, is not going to be one size fit all. Because previously, what we have seen in the generations is you did MBBS and you did MD. It was a fixed, structured plan that you gave exams, you got the results, and you got into a branch, and then you got the job. Right? Whether in a government hospital, whether you open your own clinic or a lab, it felt like a fixed set criteria. That's not going to be that any longer, and I think we're already seeing that change. So even though routine microscopy or these things might go obsolete, the pathologist knowledge will be needed to train these AI models, to train these algorithms. And every time you have a patient and every time you have a disease, the AI will have some error rate. It's a machine at the end of the day. It will not be perfect. So it will also create new types of jobs. Like I said, it's not one size fit all. It will create new types of jobs. Like being a doctor would look very different in the future. And for that, you have to ask yourself, why did you want to become a doctor in the first place?